Hello, I'm Jeremy Clark, Market Chief Executive Officer at Hilton Head Hospital, and I'd like to welcome you to another edition of our show, Healthy Living. We use this show to highlight the physicians, programs, and services that we offer to help you live a happier and healthy life. We are very proud to have been delivering extraordinary care right here at home for over 40 years. And so, on behalf of the physicians, colleagues, and volunteers at Hilton Head Hospital, I want to thank you for watching, and I hope you enjoy the show.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
No one likes to wait, especially in any ER waiting room. I mean, when I'm sick or my family has a medical issue, I don't feel like waiting around with a lot of other people. Not to mention they're sick too. Honey. And my family does not wait patiently. You can imagine how uncomfortable and how long it can seem. But then I found out it doesn't have to be that way. I can check in online and wait anywhere I want. What's not to love?
It's the smarter way to ER at Hilton Head Hospital.
Welcome to Healthy Living, and we're here today with Dr. Tracey Lever-Williams. Thank you for joining us. We're very excited to have you. Lots of new things happening for you this year. I understand you're in a new location.
Yes, ma'am. We just moved into the medical office pavilion right next to the hospital. It is actually attached, so I don't have to go out and brave the elements.
I was going to say, how handy is that?
It is. It's a 3-minute walk instead of a several-minute drive and rain and heat and all the rest of those things. It's super nice.
Oh, that's amazing. When did you move in?
It's been 2 weeks. This is our second
week
in the office.
So you're
yes,
really,
it's brand new.
Oh, that is wonderful. I wanted to talk to you today about a couple of different things, and I think the first thing I'd love to talk about is your practice specifically, the diversity of it, what you do, what you love to do, some of the patients that you see, because I know you've got just a great group, you said.
Yeah, so the patients are really a wide variety of patients. We have everything from young adolescents who are coming in because they're scared about something with their menstrual cycle or perhaps thinking about sexual activity to menopausal. I have a lovely lady whose name, of course, I couldn't mention, but she is like 98 years old, who comes in for occasional visits because she's got a couple issues going on. It's awesome to have that dichotomy in the patients and also, of course, the folks in between. So it gives me a chance to...
What is your percent, do you think, of obstetric patients to the gynecologic patients?
It's probably 80% GYN for me and 20% OB, which, I mean, we would probably like to grow the OB a little bit more for the practice, but it's kind of nice because the GYN patients don't tend to have as many problems in the middle of the night. Babies, on the other hand.
Well, let's talk about the little one first. Let's talk about the OB. What is new in the world of babies and delivering and being a good consumer, if you will, as a new, not as a new mom, but as an expecting mom?
Sure. Well, these days we're working with the hospital towards a baby-friendly initiative, which I don't know if that's something you're familiar with.
What is that?
It's a designation through a group that works nationally. It's a very coveted designation that requires lots of paperwork and lots of things for the hospital to do. But what it does is it encourages breastfeeding, which is, of course, always the best way to feed a baby, unless, of course, there's some anatomic reason why that can happen or some illness like HIV or hepatitis. It encourages that. It encourages mom and baby bonding. Encourages babies not to be in the nursery like in the old days where they'd take the baby away for hours. There's a limitation of, I think it's only an hour a day that the babies can be away from the moms. Of course, if mom cries out for a break.
Right.
That's a different story. We're not trying to punish
exactly.
anybody, but we're trying to encourage that bonding and be able to evaluate it. So these are kind of some of the new exciting things that are.
What can new moms expect when they're getting ready to go into labor? What is the advice you give them? Is it still monthly checkups from the time you find out you're pregnant? Because it seems to me, I've got 8 grandkids and 3 kids, that the kids today find out they're pregnant
Like 2 seconds after it
right,
happened?
exactly. They're like, oh, you know.
Sure. So generally speaking, we would normally make a first doctor's appointment between 6 and 8 weeks of pregnancy.
All right.
So 2 to 4 weeks after the missed period. And then we see them about once every 4 weeks until around the 28-week mark. Ultrasounds are normally done for dating at the very beginning, which is a lot different. I mean, in our day, we didn't do ultrasounds unless something was really wrong.
That's exactly right.
But now everybody gets an ultrasound for dating to make sure that we have accurate date assessment for them.
Yeah, I was going to ask you, what does dating really mean?
Well, just determining what the due date is. That's such a big thing when you're pregnant, to know what date to expect your baby, even though they never come on that day.
I was going to say,
never.
Yeah.
And then another ultrasound is generally done around 18 to 20 weeks to look at the baby's anatomy, make sure all the pieces and parts look good. And of course, the moms and dads are always worried about whether it's a boy or a girl.
And
so
now the
that's
big
kind of
thing
fun.
is, right, pink cake or blue cake.
Sure,
right?
the
Isn't it?
gender reveal is all kinds of fun. It used to happen at birth. Now it
Yes.
happens at 18 to 20 weeks.
Oh, I think that's awesome.
It is.
Anything new going on with what to expect? Again, I think things are so cyclical. I know when, again, 40 years ago, it was encouraged that a pregnant mom have a beer a week, and now it's like, oh, no.
Yeah, that's probably a big no-no now.
Sure, yeah.
We do just encourage healthy living. I think one of the biggest changes is it used to be almost like a disease state to be
Yes.
pregnant, where, oh no, you can't do that. You have to, you're delicate. You can't touch. You can't don't climb on a ladder. Don't
Right.
exercise. I have patients that go to CrossFit through
There-
their entire
yeah.
pregnancy.
There you
I
go,
love
Lydia.
that. I think it's wonderful. They make a few adaptations, but I mean, I really encourage people to be active and healthy and out there.
It's a
gives-
healthy state.
Yes, it's a healthy, normal state for almost everybody. We're ready when there's complications.
Oh,
but the
right.
more prepared you are health-wise, the less likely you are to have the complications.
Do you view yourself, it used to be that sort of physician and then expectant mother. Are you all more equals as far
I
as...
feel like it's a team.
Okay.
It's a team effort, not just with the expectant moms, but with patients in general. If I can't enlist somebody's buy-in into what we're doing,
Right.
I can tell them to do anything, but
Exactly.
they're not necessarily going to listen. They'll nod and say yes, walk out the door and not do it. That doesn't help either one of us.
What are some of the things that you think you wish more moms, expectant moms, or dads knew that really they don't know? Are there questions that they have? Because I oftentimes hear a very all or nothing kind of mentality from from expectant moms. I keep forgetting expectant. Where it's either, like you said, I either can't run or I can run. I either can't eat sushi or I can eat sushi.
Well, there's so many conflicting sources of information. The internet has not been our friend as far as that goes. It can make you paranoid about absolutely everything. Please don't be a Google MD.
Right,
It's not
exactly.
good for you.
No, that's the truth.
That is certainly a way to make yourself more paranoid instead of less, because that's where you read about all the bad things.
Exactly.
But as far as like education stuff that helps the new families out, we offer parenting classes or childbirth classes, which includes breastfeeding through Jean, who
Right.
was here earlier. I think.
Exactly.
And those are an awesome source of information. She's got a standard curriculum that they're working on that goes with the Baby Friendly Initiative.
You're pretty proud of that. That's a big
I
deal.
am. It is a huge deal.
Do most of the moms that you see want to breastfeed? Is there still the fear factor in there, or again myths, or just things that aren't necessarily realistic?
Well, I think that there's culturally a shift that's going on. We're moving back towards breastfeeding. It's interesting. Back in maybe the late 60s, they started coming out with formulas. The formula companies really pushed that. It's as good as breast milk. Well, it's fine if you can't breastfeed, but it's really not as good as the magic creation that God gave us, that we can feed our babies exactly what they need with immune support in addition to nutritional support. I mean, it gives them protection against all the things that we're
Yes,
immune to,
exactly.
especially during that critical first 3 months when they really don't have much of a functioning immune system. So we're pushing that, we're educating, we're not trying to be pushy in a
No,
mean way, but
right.
really encouraging moms to do this because it's healthy. It decreases asthma and allergies in the kids. They have fewer sick days, even later on in life. They're just generally healthier. There also have been studies that show increased IQs in babies who are
look at all the
breastfed.
parents are going, really?
So, you know, that could be
Yes.
confounded by maybe it's smarter people that breastfeed.
Right.
I don't know, but either way, I'll take it. There's actually a decreased risk of cardiovascular disease for mom later on in life. If she breastfeeds for 2 years or more during her lifetime, not necessarily one baby, it's a 2.5 times risk reduction. You can't get that from anything else that you would do.
Once a mom has a baby, how often do they come back and see you after they have the baby? And while we're talking about that, do you look at things like postpartum depression, which is something that wasn't even a word when I had my kids, right?
Sure. We absolutely do look for signs of postpartum depression. We generally see surgical delivery patients back a week after and discuss with them. And then again at 5 to 6 weeks out. And then the vaginal delivery patients 4 weeks, and then if they're having any issues with that, we certainly will see them back more. The depression can really be, it's usually about 2 weeks before it rears its ugly head in the worst way, and it really needs to be that far out before you can diagnose it.
I was going to say, is it something that you address before the actual birth, so that kind of looking for,
Depends if we have
right.
warning signs or not,
Okay.
because not everyone has them, but people with a history of depression most certainly are more at risk, and if they have a history of previous postpartum depression, absolutely they're more at risk. So we talk about it, talk about the signs, talk about, just be aware of what's
Right.
going on, and don't be afraid to ask, because it doesn't mean you're weak.
See, that is the key right there. We're going to take a quick break. We'll be right back here on Healthy Living, and we're going to talk about the GYN, the gynecologic portion of your
Perfect.
practice. So stay with us here on Healthy Living.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here at Hilton Head Hospital.
We are back here on Healthy Living. Tracey Lever-Williams has joined us in her new office space. We're so excited about that. That is absolutely wonderful. We're going to talk a little bit. We talked about babies in our first segment. Right now we're going to talk about, as we age, the more mature woman, and what the expectations are from an OBGYN as far as when I need to come in, do I need Pap smears, so many questions.
In the Pap smear thing, there's so many changes that have occurred over the last few years with that. The recommendations are now to start Pap smears at 21 years of age.
Wow.
And it used to be 21 or 3 years after the initiation of sexual activity.
Right.
Your 15-year-old still doesn't need a Pap smear.
Okay.
They might need to see me, but
Okay,
they don't need
all
a Pap
right,
smear.
okay.
Then during the 21 to 30 range, we do a Pap smear every other year, not every year like it used to, but you still have to have the physical exam every year.
Talk to me about what the Pap smear is for those people who might not be clear about why they would or wouldn't need to have it.
Well, that's actually a really good point. The Pap smear is a screening test for cervical cancer. It looks for infection with the human papillomavirus, which is a virus that can cause cancer. It's one of the very few known viruses to be oncogenic or cancer-causing. But because it creates early changes, we can detect them before it's a cancer and treat and not have any issues as far as major surgeries or chemo or anything like that.
And I guess with that, there are vaccinations now that are?
Yes, actually, all children are now recommended to have it. Everyone says children. Why are you vaccinating children against a sexually transmitted infection? Because you got to get somebody before they're ever exposed. We all want to think our kids aren't going to go out and make bad decisions, but please,
But
parents,
for those of us who have teenagers,
yes, 8 years old is when they recommend starting this, and the window is 8 to 26, and it's a 3 vaccine series, and the reduction in risk of developing both condylomas or genital warts or cervical cancer is 70 to 80% with that. I mean, that's huge.
and it's an actual vaccination?
It is. It's a series of 3.
Now, typically, would a pediatrician do that, or a general family practice doc do it, or would they come to you for that?
It can be any of the above. I actually don't think we're stocking it in the office right now, so the pediatricians who are used to doing the vaccinations on their schedule most definitely can do it.
Family docs?
Yeah, family docs. Any health department certainly can do it as well.
So now we've gotten more into the mature age. We went from 20 to 30, now 30 to 40 Pap smears.
So 30 and above until the age of 65, when you're no longer recommended to have Pap smears unless there's a history. Yeah, there's a cutoff now. You don't have to do them forever. So until that time, it's every 3 to 5 years for the Pap smear, assuming that the test is normal when it's done, and assuming that co-testing was done looking for the human papillomavirus. So we look for high-risk forms of it. If the Pap is negative and the high-risk HPV is negative, then really the recommendation is 5 years. I'm still having a little heartburn going 5 years, but 3 I can do because the testing is so much better than it used to be.
When someone comes in over the age of 50, let's say, what can they expect from their gynecologic exam? What do you do? Because I know oftentimes we as women, very healthy women, look to our gynecologist as really our first call. You know,
sure, as the primary care
I was going to say
person.
Primary care person, to be honest with you.
Yeah, and as much as I think that's not always a great idea for the generally healthy person, I mean, we're a good starting point.
Right.
And I don't mind being captain of the ship to send somebody out to the referral places that they need. And certainly, I mean, we screen blood pressure.
Right.
We can screen lipids, so cholesterol, anemia, and that sort of thing. Obviously, mammograms, starting at 40, still recommended every year.
CBC kind of things?
CBC, thyroid panel
Okay.
to make sure thyroid function is normal. These things don't necessarily have to be every single year, but more frequently as you get older, because that's when things start to go wrong.
So what is the recommendation for visiting your gynecologist over the age of, let's say, 40 or 50?
Still every year.
Okay.
The physical exam should be every year. It's the lab tests and the mammograms that may change in the recommendations.
And with the physical exam, what are you doing? What are you feeling for? What are you hoping not to or to find?
Well, obviously the breast exam is an important part of what we do. We're looking for breast cancer. It affects 1 in 8 women if you live to be in your 80s. It's really 12 to 15%. That's crazy.
It's significant.
Right. So we are doing breast exam, feeling for, I'm trying to demonstrate.
Well, exactly. Well, we all do that. We're doing breast exams, right?
Exactly. So we're feeling for lumps or bumps, and everyone says, but Doc, I'm lumpy. That's how am I supposed to tell? Well, you want to feel for things that are stuck to the bone underneath, or to the skin on the outside. Take a look in the mirror, lean forward, let the girls dangle a little bit.
Right, exactly.
And look for any indentations that might occur, because those can be early warning signs of very small tumors.
Nipples, underarms, those kinds of things too?
Nipples, underarms, nipple retraction. If that occurs and hadn't been like that before, that's certainly a warning sign.
When someone has a mammogram, then does that mammogram go back to you and it's kept within your file?
It does.
Or my file in your office?
Correct,
Right.
correct.
Okay.
Yeah, it comes to me. And actually, they'll even allow you to get a mammogram done if you haven't been in to see me yet, which every once in a while creates some confusion for us. But you can go get that done and then come in for your annual exam, so that way all the information is already there.
Okay.
There's some benefit to that.
And so what else are you testing for or examining for in the actual examination?
So then just a general physical exam, checking the thyroid to make sure that it's not enlarged and no lumps. We're listening to the heart and lungs.
For what?
Heart murmurs.
General health?
General health, exactly. Lungs, I mean, obviously you want to look for decreased breath sounds and just normal movement, normal sounds. As long as all that looks normal, listen to the belly and make sure the bowel sounds seem reasonable.
As my stomach's growling now.
Ours are going to talk.
Yeah, exactly.
And then we move down to the more private. Always start at the top, work our way down. Once we get to the kind of female areas, then we're looking for any signs of vaginal infections, any signs of vaginal atrophy that can occur with menopause and aging.
What does that mean?
Oh, it's decreased estrogen leading to thin vaginal tissue and perivaginal tissue, which can cause pain during sex and vaginal dryness, which is really a problem for a lot of our menopausal women. So we're looking for that. We're looking for any signs of cervical cancer, any signs of fibroids or other anatomic things.
And is that what you're feeling when you're pressing?
The bimanual exam have to
Right,
demonstrate.
exactly. When you're pushing on your tummy, is that,
I can't help but demonstrate everything, I guess. We're looking for enlargement of the ovaries, enlargement of the uterus, any tenderness that we wouldn't expect to be there.
Are there things that you would look at specifically for a woman as she gets older as opposed to the younger woman? Is menopause really the significant deal?
Really, the big difference there is going to be the lack of estrogen symptoms that can occur. And of course, as you get older, your risks of developing certain kinds of cancers increase, such as ovarian cancer. The average age is in the mid-50s for development of that. So, I mean, certainly we pay a little more attention for an enlarged ovary in a 55-year-old than we do a 15-year-old.
Well, that makes a lot of sense.
Right.
It really does. And then once you have that examination, recommendations are made, rectal exam, things like that, pretty much?
Rectal exam, that's always a controversial thing. Patients don't necessarily love it. I have a tendency, if I feel like I have a good exam without it, and someone who's up to date on their colonoscopy, that's the important key. I've got to know that you're up to date on that and didn't have any problems. Then we can kind of let you get away with it a little bit more.
But typically you'd be looking for rectal cancers, things.
Right, rectal cancers, also masses that you may not be able to feel through the vaginal exam, but you would be able to feel rectally. It can definitely be useful in order to feel ovaries a little better, or sometimes depending on the position of the uterus itself.
Well, with menopause being such a significant issue for women who are over 50 now?
Average age is 51 to 53.
When someone comes in and they're wondering if they are perimenopausal or menopausal, what are some of the criteria that you ask them to look at? Are you?
It's all about symptoms. It's vasomotor symptoms of menopause, and it's also about not having menstrual cycles anymore. 1 year with no period is part of the criteria. Also, you know, a lot of times people will want to do lab tests. They want to check their hormones.
Right.
You know, we don't treat labs. I don't anyway. I don't believe in that. I treat
people.
patients. Right. So if you're coming in because you're having hot flashes, night sweats that are waking you up because you're drenched in the bed, these are perimenopause or menopausal symptoms. Even if you haven't stopped having your period yet, it's still perimenopause and it's miserable. We can treat it and we can make it better.
Oh my gosh, are you the best ever? You're a great guest. It's really fun to talk with you. We always learn something new. Again, thank you so much for joining us. We want to thank all of you for joining us here on Healthy Living. Have a wonderful week.